Hi, beautiful people. Tatiana Creeley here. We have another patching podcast happening tonight, and I'll talk to you about inflammation. Is it a reason for your discomfort, and what can you maybe do about it? So it's quite an interesting topic. Inflammation is pretty much everywhere. When we start to look, it's pretty interesting. Before I go into further details, as I said, I'm Tatiana Creeley, and I will talk to you about some beautiful little patches I've come across 8 months ago. They look like this. This is when the sticker is ready to stick on, pretty much like this. And they're really, really exciting. So if you haven't seen about them or heard about them or haven't seen them yet, it is a patented nanocrystal technology in this white part in the middle. And this is really, really interesting for what's happening with the body. The body emits an infrared light and that hits that white part of the patch. And the patch acts like a mirror and sends the frequency or a specific frequency back into the body. So I would like to go on with making sure that, I'm not a doctor, I'm not your doctor, and all the information that you hear tonight is for informational purposes only. So we're not here to cure, diagnose, treat, or heal anything. It's all for information purposes. And please make sure that you consult with your doctor if you have any questions or if you like to try what I'm showing you. So yeah, as I said, we have these beautiful little patches. One of the main patch is called, show you, X39. And X39 is, the one that actually activates or elevates our own copper peptide in our body. So that is a really interesting peptide. You might have maybe heard about it. The copper peptide in the body, when you elevate that, it really starts a lot of interesting processes and works on cell repair. It works on improving your nail, your skin, your hair. It works on all different sorts of things. Plus, it actually works also on activating our dormant stem cells. And it sets about a third of our genes back into a natural or into a younger, what do you call them? Younger stage. So really, really interesting. And what I've seen around me with what people experience with the patches is really, really mind blowing. So yeah, all sorts of topics. As you can imagine, stem cells are the building blocks. Stem cells are there to create us. We started out of nothing. We started out of, literally tiny, tiny, weeny nothing. And bit by bit, all of a sudden we have a baby and the baby's growing bigger. So we need some building blocks for that. We have an amazing intelligence in our body that we know how we need to heal or where there is something wrong. And the stem cells know where to go when they need to do some repairs. So if they go dormant in our age, when we turn 35, we start to lose the stem cells and they go dormant. And that means we don't repair as much or we don't regenerate as much. So slowly the aging comes in. If we can get these stem cells activated again and they're up and running and they're back to their jobs, well, they know where the most important or most pressing issues are and they start to repair in these areas. And yeah, so what you do with a patch, you put it on, I have mine, I think you might see it on my neck. I don't know if you do see it. You can put it on your neck or you can put it under your belly button. That's the X39. You can put it pretty much anywhere on the body. But there's a couple of interesting or spots that have been used in the clinical studies, and we like to keep it very simple. So you put them on specific simple spots. You can have a shower. You can swim with them. Like there's waterproof. There's a bit of plastic around it that keeps it nice and safe. And yeah, it sticks on your body. You can put it straight on the skin. A lot of people do wear it straight on the skin, but you can also put it on your clothes if you might have sensitive skin, and you can wear it over clothes or inside the clothes. That's fine too, because it works with the infrared light of our body. What else is important about them? You wear them about 12 hours on, 12 hours off. So usually the simplest way to remember, you get up in the morning, you might brush your teeth, get ready for the day, put it on, and then come home and 12 hours later, you take it off again. It's just a routine every day. Consistency is a key. And when you keep using them every day, you will have a compounding effect. So the recommendation is to use them per decade you live, to use them 1 month. So in my case, I'm getting close to the 50, means 5 months would be my recommended time frame for using them. So I've been using them for over 8 months now. And I have to say, in the first month, I felt like we really start to get just everything ready. And the body went like, whoa, what is this? We need to get this army organized to really work on things. So sometimes I felt nothing, and sometimes I went like, whoa, I'm really in a bit of a, healing cycle or something that the body is moving and shifting and detoxing as well. I was thirsty. So bits and pieces. Everybody is individual and different. And then over time, again, I've sometimes felt like, oh, yeah, there's a bit happening. And then sometimes, maybe not. So it takes time. And when I hit my 5 months, I thought it was pretty much the time, 5 to 6 months. I thought, you know what? Now I'm actually feeling like I'm really starting because there is always something to regenerate. Basically, a golden rule is when you want to stop to regenerate, that's when you stop patching. Obviously, it's your choice. That's what I really like about it. So you can choose if you want to patch, how long you want to patch, how much you want to do it. It's all your responsibility, all your choice. The magic on the amazing part about it is it's non-invasive. There's nothing going into your body. So there's no chemicals going into your body. There's nothing coming from this white part apart from the frequency that is just reflected in the white part back into your body. That's pretty cool. So yeah, you can't do anything wrong. And yeah, you certainly can't get in toxins in your system, which I really love. That's one of the things that really interested me a lot, especially coming from a background of natural health and therapies. I'm a bone therapist by trade. So that's really amazing when we can help our body with all the resources the body has within, which is awesome. Yeah, I'm going a little bit closer today in a topic. You don't need to know the nitty-gritty, but sometimes it's good to have a bit of a background information. That's why I want to touch inflammation. So, yeah, listen carefully and you might pick something up for yourself. You might get a bit of a aha moment. We'll see how that goes. So, inflammation is, yeah, a topic we know. Inflammation, everybody had some obvious inflammation here or there, tiny weeny, you can see it in the body. Or the interesting thing is that inflammation can be around and you might not even quite aware of it. So if you still have problems in your body, even that you might have tried everything, all different types of, therapies, bits and pieces to support, to detox, but nothing has really worked. Nothing has really moved. And you're still having trouble maybe moving or doing exercise or whatever. You still have, ongoing symptoms. That could be because you have potential hidden inflammations. We can't see them. They're inside our body. There's not like a big lump showing, oh, there's a big red lump or whatever, showing the inflammation. No, it's internal. And a lot of times, as we know, our bodies, the internal parts are obviously the most important parts. So we have, the important organs like the liver and the kidneys and the lungs and the heart and the intestines and the brain, of course. Everything is so important. So we want to make sure that this stays clean and clear and as functional as possible. And inflammation is one thing we don't want. So when the inflammation is on the outside, as I said, it can get red and it's a bit of a swelling and you really see it. And it can be painful too. But the inflammation on the inside can cause pain as well, just not the obvious that the pain is from the inflammation. So you have to come to, a bit of a thinking process or, I don't know, process that you go to get some checkups with your doctor or wherever you go. And you get an information that there is inflammation in your body. Or you just, have a bit of common sense, maybe thinking about it. So a lot of times, unfortunately, we might have issues and you can't find the answer or no one can find the answer. And there could be a bit of, it might be an emotional thing or it might be, in your head or whatever you want to call it. Now, in this case, if you have some issues and you can't locate it, you don't know where the reason is, no one can find anything, you really want to think of inflammation. So what happens in our system, this brings us or puts us into a so-called survival mode. So we're just functioning. The body is functioning to survive, to just be able to do the necessity in everyday life. And if that's the case, well, we can't heal because there is no space, there is no energy, there is no time for healing because the inflammation is so strong or governs our system at the time that there's just no attention for healing because all the system is in functioning mode. So yeah, certain things they don't show up. You might get tested, but it doesn't show up. Whatever it is. So again, it could be potential that you walk around trying to find some answers and then you go, oh, well, you might be depressed or you might have something in your head that causes your pain. Who knows? I guess you might know. If this is you, you will know what your personal journey is and what you might have found as answers or not. So coming to the inflammation itself, what are inflammations? Inflammation is a natural reaction of the body to harmful stimuli such as infections or injuries or harmful chemicals. Who doesn't have chemicals around them? Or, we might think, oh, a chemical, you might have a drum of petrol or whatever, or some toxic cleaning product or something. Well, the chemicals are everywhere. Just fueling up your car, you have chemicals. Touching certain things in your household, you might have some chemicals on your hands. And don't go into the bathroom in the kitchen in some houses. Well, I personally would just empty them out and put them straight somewhere into the bin because I reckon we don't need chemicals to clean the house. I'm quite happy with lemon and bicarb soda, for example, a bit of vinegar and eucalypt oil, and my kitchen is complete. So that's what I'm happy with when it comes to the cleaning products. And I think it's pretty similar in the bathroom here. But that's not everybody's home. So you can choose for yourself what's your priority. It's the body's responses to protect it and repair the damaged tissue. This is what it is when we have inflammation. So, however, the inflammation can also lead to health problems. And if it's chronic, well, or excessive, that's when we do have health issues. The causes of inflammation, there is various different things. So we, as I said, we can have infections, bacteria, viruses, fungi, parasites. They all can cause inflammation. And yeah, what am I saying? Sorry, lost my phrase. The infections is one reason. Don't want to go too much into the detail. The injuries, when we had an injury, we have a cut or a sprain or broken bone. Again, it activates inflammatory response in the system, and the body wants to heal. So there's a little bit of inflammation happening at the time to support the healing. It's just part of the process. An autoimmune disease, again, is when our body sort of attacks ourselves, it can lead to chronic inflammation. Where the cause for that is, I guess there's different opinions out there as well, but that's just another thing. When you think of autoimmune disease, rheumatoid arthritis or lupus, you always have the word inflammation in your head as well. Some chronic diseases, obesity, diabetes, cardiovascular diseases, they're all associated with chronic inflammation. And then we've got the environmental factors like smoking, obvious air pollution. I think that's pretty easy to get as well, unless you're living far away somewhere in whoop whoop. And yeah, any other chemicals you might ingest for whatever reason. The diet, fancy that. Diet is another reason that can cause another issue, can cause inflammation. Rich in sugar, unhealthy fats, and processed foods can also promote inflammation. So when I go through the supermarket, unfortunately, I think personally, sorry, supermarket, 80% of the products I walk past really, and you just get a few things. And nowadays, unfortunately, when you go to the fruit and veggie section, unless it's organic, you don't even know what you've got on that. So unfortunately, it is pretty tricky to do the right thing in your diet as well, even if you want to. Yeah, so acute inflammation versus chronic inflammation, another topic. Acute inflammation occurs quickly and is usually short-lived. So as I said before, that's redness, warmth, or swelling, or pain. And yeah, the loss of the function is common as well. And it just is supporting our healing. That's in this acute situation. When it comes to chronic inflammation, this can last for months or for years, and it often occurs when the inflammatory process is not properly regulated. So it really can't, push its way through. It's not finished. It keeps going. And the chronic inflammation can be then triggered by persistent infections or the autoimmune diseases or poor lifestyle habits. We mentioned a couple of these things before as well. What are the consequences when we have inflammation in the body? We can get tissue damage. So it can damage, the severe inflammation can really lead to damage of the affected tissue. And it is the permanent inflammation actually permanently destroys tissue as well. Can lead then we have joint damage and arthritis, typical word. Again, back to inflammation. So it's just, building up, as I said, about a different topic to my children today. It's one grain of sand, at a time. If you have a bucket, if you keep putting another grain in, another one, and then eventually, is it grain? I don't even know the English word. I think it's grain. Or little corn, little piece of sand. And eventually your bucket is full. And that's how our body works as well. It's another little bit, there's another little a bit of a soft drink is a little, bit of salt. And then we might have some hot chips with a bit of salt. And we might have, I don't know, alcohol. It's a little bit of salt. Eventually the bucket is full. And then the body goes, hey, my bucket is full. I really need you to do something because otherwise I'm just overflowing. And then I'm telling you that I'm overflowing because I'm just giving you some pain. And people go, oh, what happened all of a sudden? So, yeah, inflammation. Topic cancer is related to inflammation or can be related to it as well. So, increases the risk of cancer if we have chronic inflammation, according to my research. So, yeah, some cancers, such as colon cancer, are associated with chronic inflammation. Yes, cardiovascular disease, chronic inflammation can damage arteries and lead to the formation of plaque in blood vessels. So it increases the risk of heart attacks and strokes. Again, who needs inflammation? Diabetes, the chronic inflammation can cause insulin resistance, so which can lead to type 2 diabetes and neurodegenerative diseases. So, yeah, inflammation in the brain is linked to diseases such as Alzheimer's, Parkinson's, because it just damages the nerve cells. It really affects pretty much the whole body, just on all different areas. Muscle wasting and fatigue, we don't need that either. Then we got immune system weakening. Well, that causes more trouble. If the immune system weakens, we know then everything just gets a little bit harder as well because it's just so susceptible for further diseases, as we know. Yeah, what is the conclusion? Inflammation is a normal defense reaction of the body, but when it gets out of control and becomes chronic, it just can cause serious health issues, health problems. So you want to be really put all your antennas up and just be conscious about, maybe how do you feel for the start? Could it be inflammation? What happens if you have pain? You don't find an answer and you go and you just take a painkiller. Well, if you know that chemicals will support inflammation, you really don't work on the root cause. Just saying. So it's just a thought. There's different ways of looking at things. So you really want to make sure that your bucket with sand is going to get emptied and not just another drop, and you might push the bucket onto another place, trying to shift it into another corner of your house. No, you really want to make sure that you empty this bucket in time. And there's obviously different ways to do it. So detoxing is one big thing. Helping with the nutrition is another one. And we really want to break this cycle of inflammation. So what else can we do about it? I showed you these little beautiful stickers. We have lots of different ones to offer there. We've got actually 12 different ones. So I don't want to go and tell you all these different, all things about these different types of patches. I want to focus on one today, which is so-called one of my favorites. Another favorite. Got a lot of favorites. The Aeon. The Aeon can break this cycle of inflammation, and it again works the same principle. It works with the sticker on your body, and the white part is a mirror. It doesn't elevate copper peptides. It elevates, it's called SOD. I'm not a scientist, but I know how to use it. It actually elevates, yeah, don't ask me. I have to look it up. SOD, whatever it is, you can Google it. It helps to reduce the inflammation in the body. That's what I need to know. If I offer someone a patch, I need to know what to use it for. So as I said, I'm not a researcher, don't go into the papers, into the depth, but I need to understand when I need to use the patch. The Aeon can change the level of inflammation within seconds. It de-stresses, it's a so-called happy patch, and it brings our body into the parasympathetic nervous system, which means the parasympathetic nervous system is the calming down. It's the time when we can digest, when we can relax, when we can let go. Whilst the opposite is the sympathetic, the fight, flight, the go, go, go. This is where we, when we chase a tiger, or actually the tiger chases us and we can run away. So depending which position you want to take. But that's the sympathetic. And the parasympathetic is pretty much you sit back, you relax, you're under the tree, you can let your meal go through your stomach, you can digest, and all these vital functions can really work well to support, to nurture, and to regenerate. So that's really, really important. And that's where the Aeon comes very, very handy to break that cycle of inflammation. And if we regenerate the pain and silent inflammation, then you can get out of the long-term inflammation and become symptom-free. And that's that's a really good key, a really good tool to help you to break this cycle. Because I'm sure if you go from A to B to Z to Z and you still wonder what's wrong with you, why you're aching, your bucket is full. You need to break that cycle. You need to get rid of the inflammation. You need to find a way to help yourself. So Aeon is one tool. Obviously, then we need to do a few more things to support it. It will do its thing, but the better you support that, the better your tool will work. Make sure if you want to clean that bucket, water helps. That is really supportive. Just use the right tool. Maybe even a shovel, whatever that is, might be another supplement or another patch to help you to really empty that bucket. So there's different options out there, but the Aeon is the key to open the door to bring that inflammation down. So I'm really, really excited about that one. Another really great use for the Aeon while I talk about it is if you happen to be a person to go to bed and you like to heal or solve the world problems as soon as you go to bed and hit that pillow, this is the one you want to use. You want to go to the Aeon because it brings you into the calming stage. It really calms your thinking down. It de-stresses you and you can go to sleep again. Then you can repair. The inflammation can go better down. And this is all shown in clinical studies. Every patch has their own clinical studies. You can look them all up. You can read about them. If you like to go into the research, there's tons of information there, and you can really go into the nitty-gritty if this is you. If you are just thinking, I need something to help me feel better, well, as I said, it's very, very simple. As long as you put the patch on your body, that's a good start. And then one step at a time. Make sure you have a bit of water. And I just spoke to someone today. If you can start getting up in the morning, put your patch on, have a glass of water, or I'm actually drinking half a liter of water with lemon and honey, and the same thing before I go to bed. Just helps with your fluids, helps with your detox, helps your liver, and helps, with your electrolytes. It's another little step. We don't have to build Rome in one day. Rome can be pretty bloody big if you want to build Rome. So make sure you just take it one brick at a time. Or one of my instructors used to say, you can't eat an elephant at once. And then you just go, you start with a toenail. As long as you do something, you take the responsibility for this, you're on the right path. So, yep, that's my message to you today. If you have any questions, make sure you go back to the person who invited you to this call or who shared this video with you. They're more than happy to help you out. We're here 3 times a week, Tuesdays, Wednesdays, and Thursdays. Feel free to tune in and yeah, otherwise check out our YouTube channel as well, or my YouTube channel, Tatiana Creeley. You find my videos on there as well. And yeah, get in touch if you have any questions or if you like to break this cycle of inflammation and you're curious to hear more about what we have to say and how amazing this light technology is. So we're here to share the light, to share it into the world because it's such an amazing, groundbreaking technology. If it sparks your interest, if it resonates with you, give it a go. If not, completely fine. This is not for everyone, but I think it's for a lot of people because we do have a lot of people who are very, very grateful that they have found these because they're so simple and so effective. So, yeah, the only way to find out, give it a go. Thank you so much. We don't have any questions in the chat. No, we don't. Speak now or send me a message later. Okay. Thank you so much for listening. And you're more powerful than you think. Thanks heaps. Have a wonderful day, night, whatever you are, wherever you are, and talk to you soon. Thank you. Bye.